Hi everybody, welcome to Laura's Social Corner and another episode with, today is very special because she's my really good friend and she's the doctor, Irim. Welcome.
Thank you so much. Thank you for having me.
No, it's my pleasure because we're going to talk as usual, as normal. We always talk something very important. And today the topic is about saving life because you are in oncology.
Yes.
And this month is the colon cancer prevention.
Yes,
right?
Colon Cancer Awareness Month.
Tell us what we can do to keep our colon healthy. Because I heard 100 things and it's just difficult.
Yes. So first of all, for colon cancer, screening is an extremely important part of colon cancer prevention and early detection. So screening can be one of two things at this stage. Screening can be either a colonoscopy or a test called a Cologuard test. So if you're very, very afraid to do a colonoscopy and you want an alternative, there is a Cologuard test which tests for cancer cells in the stool, and it can be effective as well. Now, nothing really, in my opinion, is as good as a direct look with the screening colonoscopy, but that takes a little bit more effort on the part of the patient in terms of drinking and cleaning out the colon so that the gastroenterologist or GI doctors can go in with a scope and take a look and actually remove polyps if needed that can potentially become colon cancer at a later date.
What is the age? The right age to do, because now is everybody getting colon cancer, younger people.
Yeah, exactly. So I would say start screening at between 40 and 50 years old.
That's like a no option. You have to.
Yeah, by 50 you should have had your first screening done.
Right, and then also can be because it's like an heritage. You can get it from your mom, from your dad.
Yes. So there are some inherited colon cancers, and that's under a syndrome of cancers called Lynch syndrome. And if we, in our very young patients, we do test, and actually in different age groups and specifications, we do test to see if people have an inherited form of colon cancer. There's inherited forms of multiple colon polyps, any one of which can become cancer, and we have different recommendations for those patients as well.
What is the recommendation?
So it depends on what patient. Your risk of cancer is. It can be anywhere from increased screening to as extreme as getting part of your bowels or colon resected.
So if your mom or your dad have colon cancer, is maybe 80% you're going to get colon cancer, or 50-50?
No, so sometimes so 1 in 25 people get colon cancer. So that's a pretty big percentage of the population. And so, yes, so it can be genetic, or it doesn't necessarily have to be genetic. So we look at certain things about people's colon cancer to determine whether it could be genetic, and we do genetic testing on people with colon cancer, especially very young people with colon cancer. It's routinely not genetic, but when it is genetic, we have to do a thorough family screening to make sure other people aren't carrying that risk within the family.
Wow. So I want to ask you something maybe a little more personal, because you look so young, because she is young. Why you decide to be a doctor? Because right now, for me, it's like the young people. Nobody want to be a doctor.
Yes. Well, it is a difficult career choice for many reasons nowadays. The burnout rate is pretty high because not only do you care for patients, which I love to do, but you deal with a lot of the logistics and insurance policies and prior authorizations and things that we, number one, weren't trained to do, and number two, is almost unfair to ask us as medical professionals to take care of. So insurances oftentimes don't want to pay for things, so then you have to make phone calls to insurances and explain to them why you want to do things a certain way. And they have, unfortunately, people who have decided, if we deny X, Y, and Z, how much money are we going to save? So unfortunately, insurances aren't in the business, as we think, of insuring people. They're in the business of making money. Yes.
Right. What has been the most meaningful moments on your career so far?
I think the day-to-day personal moments of patients. I love taking care of patients because once someone gets diagnosed with cancer, they it's almost like they become a different person. They become more resilient. They see what's important in life. They have a different outlook on life. And, you know, some of my cancer patients are some of the most positive people I know, surprisingly. You would not think so because, you know, they have a huge, tough illness and a long road ahead of them. But, you know, they come in, they're positive,
And this is one of the things that I admire you, because you deal with a lot of people that have cancer, and you're very. This is where you're always kind, you know, because you hear a lot of stories and make see life a little bit different than everybody else.
Yes. I mean, you're more thankful for, you know, the things that you have, for sure, for your own health, and in keeping yourself healthy as well. It becomes very important.
What would be one of the recommendations to keep you
Yes.
to keep you colon healthy?
So eating well, you know, there is a linkage of colon cancer to a heavy meat diet, red meat diet. Eating well, there's some studies that show that aspirin can decrease the risk of colon cancer. So maybe, you know, after 50, adding a baby aspirin a day to help decrease the risk of
Really?
of
Just
colon
not
cancer.
only for the heart, because I
Yes.
heard that it's for the heart.
Yes.
So it's also good for, that's a good thing to know. I didn't know that.
Yes.
So it's a baby aspirin every day.
Yes.
Maybe can help.
Yes.
But we better take some prevention.
Take some prevention, and again, the most important thing is a screening colonoscopy, which if your colon is clean at your screening colonoscopy, it's only done once every 10 years. It is a pain in the rear, literally, but you know, it can prevent you from getting a cancer that could either be a cancer that can kill you, or it could be a cancer that requires further treatment such as surgery or even chemotherapy. So we're trying to catch it very, very early when it's still in baby phases or polyp phase. So the GI doctors, the stomach doctors, can go in and just cut it out, and we never have to worry about it becoming a cancer at all because it's already been removed.
So that colon cancer is one of the cancers that is very hard to detect, because they don't have
It's easy to detect with a colonoscopy.
But if you don't have any symptoms, or how if you're not 45, you're 30.
Yeah.
What is the symptoms?
Yeah, so typically we don't see it present that early,
Okay.
which is a good thing.
Right.
And that's why the screening guidelines are written as such, because of the age of diagnosis typically. So it takes 10 years for a polyp to become a full-blown cancer in the colon. So 10 years. So that's why the screening guidelines are for getting a colonoscopy every 10 years if you have a clean colon and no precancerous polyps. And so if you get your routine screening done, you know, the chance of you getting colon cancer drops quite a bit.
Oh, wonderful. So who is more susceptible to get cancer, colon cancer, women or men? Who get the most?
There's not really a massive difference in the two. No.
Wow. So example, if somebody have breast cancer, you're more likely to have colon cancer, or they're completely separate things?
So if you have a genetic mutation, there's a potential of increased risk of colon cancer, along with certain other cancers, depending on what mutations you have in your genes. But mostly they're separate entities.
How you deal with the people, you know, I know how you deal with the people, be very patient, but when you get home, where do you get released to get all the pressure out? Because it's hard.
Yes, yeah, it is. You know, even today I had a pretty tough day. I had a patient who I've cared for a very long time, who has breast cancer. She's young, she's 57, so not much older than me. And she has metastatic breast cancer. So she originally had local breast cancer, and we did everything we could to make sure that it didn't spread. Unfortunately, while on treatment, that cancer spread. And now the cancer has filled up her liver, and we really maybe have one more line of therapy that we can give her that I'm not sure it's going to work. Things work for 3-4 months, and then they stop working, and we have to move on to something else. And it was a very difficult conversation I had to have with her today. And sitting there, before I got emotional, I just had to remember that she's the one going through it. So if I get upset or if I get emotional, that's not my place to be emotional. That's, I need to comfort her. I need to comfort her. So I had to kind of stop myself and take a little
wow.
moment and a breath and try to not get emotional myself while I was, giving her the information. And then, typically what has helped me quite a bit is, hanging out with friends and, just not talking about work. And
That helps everybody.
That helps everybody. Girlfriends are the best
Yes,
therapy.
that's right, 100%.
Yes. And also, I've picked up quite a bit of working out added to my life. And so that's actually a huge stress reliever, which also helps reduce your risk for cancer.
The stress, right? The stress is now very
reducing
popular.
stress and working out helps you reduce your risk of cancers.
Yes. She's the ones that really admire her. She's the ones that you see her at the gym at 5 in the morning. She's my
Just like you.
5 in the morning, they know where to find us.
Yeah.
So but I'm really always admire because you're always positive and doing a lot of stuff.
Oh, thank you.
And she goes to, but you're right, you need it for your career to balance it out.
Yeah. Well, and another thing, my aunt told me when I was very young, I was 12 or 13 years old, she said, nobody can make you happy. Only you can make yourself happy.
That's a really good advice. Only we can do ourselves happy, nobody else.
Nobody else. So you can have the happiest life, but only you can make yourself happy. And you can have the saddest life, but you can still make yourself happy.
That's right. That's a good advice for a 12-year-old girl. And you still keep it.
Yes.
That's why you are so happy. What else we can say about the colon cancer to the people that is
and just again, the importance of screening. I mean, it's very, very important to talk to your doctor, to get screened. I'm still so shocked that so many people don't get screened and, aren't able to prevent a purely preventable cancer.
So that's a more preventable cancer?
Yes, it's a very preventable cancer.
Oh, wow.
Just like, mammograms, we women go and get screened every year. It's very, very important to get screened because you can just take out a polyp and have it never develop into a cancer. And in that case...
Why do the people be scared about it? Where you can tell them, don't be scared, what is easy process?
Yes.
To put you to sleep.
I think people don't want to take the PrEP, which I respect because it's not easy to take that for a whole day. You're nauseous, you're bloated, you're getting your colon clean, you're having the diarrhea.
I love it. I love mine because I lost like 3 pounds immediately.
I hate the PrEP. So, but I think a lot of it, or, people put their health on the back burner because, you have to plan it out. So, unlike a mammogram where you just show up and they get it done, this is like a 2-day process. One day you have to plan to take the PrEP, and then the next day you have to plan to get the colonoscopy. So I think people just say, okay, I'll do it, and then you know how it is. Yeah. Our kids are growing, years pass by, nothing gets done. So
yeah, and this is important because that's the reason you have to do it, because you have kids.
Yes.
And then you need to be healthy.
Yes.
But it's incredible how the men, especially, they don't want to do it.
Yes. Yeah.
It's just in Oklahoma City. So we have a good numbers of doctors that they do what you do.
Yes.
It's men and women. So
yes.
They can go either way.
Yeah.
So
and the colonoscopy is done by a GI doctor, and we have a robust number of GI doctors, both men and women.
Really here in Oklahoma?
Yes.
So where you graduated? Tell us about your background.
So I grew up in Oklahoma City. I went to the University of Oklahoma for medical school.
Oh, wow.
And then I went to Chicago to get away for a little bit for residency and fellowship. But my family's here, and it was a good place to settle down, so we moved back. I met my husband, moved back, and we live in Oklahoma City again now.
Your husband, he's a heart doctor?
Yes, he's a cardiologist.
Both ways. But I don't see him at the gym.
Yeah.
We need to bring him to...
We need to bring him to the gym too, yes.
At 5 in the morning.
Yes.
To everybody that's watching, don't ignore your health, right?
Don't ignore your health.
Or symptoms or...
And I mean, again, if I can emphasize one thing, it's that you can prevent colon cancer. So it's not just you're taking care of it, you're preventing it from ever happening. So you don't have to go through a surgery for colon cancer. You don't have to go through chemotherapy for colon cancer. Or God forbid, you don't have to die from colon cancer. this is all purely preventable. And so if somebody told you, hey, Laura, do this thing once every 10 years and you won't die, I think everyone would be on board.
got
Yes,
a key,
I'll do
yeah.
it. Yeah.
That's the right way to say it. Do this every 10 years and you're not going to die
From
with
that disease
from
process.
that colon
Yes.
cancer.
Yes.
Because it's very common now.
Yes.
It's very high, the risk is. But I appreciate that you take your time. I know you're super busy
Yeah.
to come and talk to us and,
course,
and the
of
people that are watching. So I appreciate it a lot.
course,
And
of
thank
course.
you so much for all what you do, because you are in the front line,
Oh, you're sweet.
saving life and treat everybody like they should.
Yeah.
And you are that kind of person. So
Well,
thank you so much for
Well,
being
thank
here.
you for having me, and it was really fun. And it's always fun to hang out with you and get to see you.
Yes. Thank you so much, and see you next time. Take care of your health and get a screen, right?
Yes, get screened.
Bye. See you next time.